Recently, Sultan-ul-Uloom College of Pharmacy organized a workshop titled Clinical Pharmacist Intervention. In this video, you will first watch the complete workshop report. After that, students who attended the workshop share their detailed thoughts and experiences. Make sure to watch the video till the end. Follow Mags Horizon on Instagram and don't forget to subscribe to the Mags Horizon YouTube channel. Sultan-ul-Uloom College of Pharmacy organized a comprehensive workshop on clinical pharmacist intervention aimed at Doctor of Pharmacy students, Master of Pharmacy in Pharmacy Practice students, and final year Bachelor of Pharmacy students. The workshop focused on strengthening clinical knowledge and improving practical decision-making skills essential for modern pharmacy practice. The sessions were conducted by Dr. Kartik Rakam, Chief Executive Officer of Avenida, and Dr. Juzar Sabuwala, an alumni of the college and a registered pharmacist in Canada who successfully cleared the PEBC examinations. The speakers highlighted real-world clinical interventions through case analysis, structured evaluation of patient data, and interactive discussion of clinical case studies. Dr. Juzar Sabuwala also shared his professional journey from Sultan-ul-Uloom College of Pharmacy in India to becoming a registered pharmacist in Canada, highlighting sustained effort, learning, and determination in achieving international professional goals. Students actively participated in group-based question-answer sessions and responded confidently, reflecting strong subject understanding. The workshop was conducted in two parallel sessions held simultaneously in separate seminar halls led individually by both speakers. Dr. Anupama Koneru, Principal Sultan-ul-Uloom College of Pharmacy, introduced the college alumni to junior students and emphasized the importance of clinical pharmacist intervention in healthcare, while expressing gratitude to both speakers for their valuable contributions. Students shared that the workshop significantly enhanced their clinical insight and practical outlook. The program concluded with the presentation of mementos and a vote of thanks by Ms. Zainab Hussain.
Shumasa from B Farm fourth year. As I'm from B Farm, we are not exposed much to the case studies, but this was our first time. The major takeaways or important points will be pharmacogenomics, economics, and sir also shared a lot of references where we can obtain the complete drug information like US FDA access data where we can get the complete monograph of the drug, and sir also emphasized on patient compliances like he shared a drug linozolid. They are available in two dosage forms like tablet and injection as well, but the injection one is way more costlier, like it costs for complete treatment it costs around 12,000, but the linozolid tablet which is around 150 or something, I don't remember, but it gives the same effect as the linozolid injection. So the major role of the pharmacist should also be the compliance as well, and ADRs also should be counseled like rifampicin, red secretions, body fluid secretions can be done. So clinical pharmacist should also intervene in that and counsel the patient well. uh, yes, thank you.
All the things that are being covered by my juniors as well, and most of them is also covered by you as well. So I would say one thing: I have a lot to cover in my studies as well. Being in a fifth year, yeah, it's no joke that I have studied hard. I have done a lot, but I just felt today that I'm lacking very behind today because one thing I felt is normally we use in fifth year we go for our thesis to the hospitals. We go through all the cases, all the lab investigations and everything. But when I saw your case, where superficial data was there, and from the superficial data, you decoded the drug interactions, possible drug interactions, and we also could, like, if we did in the future, we could also narrow down the possibilities of drug interactions, ADRs, or we could even predict the type of reactions and the efficacy of the drug that we may get as a result if we are practicing as a clinical pharmacist in the future. So I feel I'm very lacking behind in the medical part.
From pharmacy practice. So we've been doing these case studies, like we started to do these case studies, and we were working on few. But today we've worked on different things that consider all the factors that, as a clinical pharmacist, we need to intervene in the therapy, in the elements, whatever interventions as a pharmacist has to be done. That includes ADR detections, drug interactions, and also pharmacoeconomic analysis. So that is what we have learned. Thank you for that. It has been very informative and useful for us. Thank you.
Everyone. This is Itisam Saeed of B Pharmacy 4th year. Today's session was conducted by Jose sir. I'm really grateful for Anupama ma'am for considering B Pharm as well. It was really nice. It was very informative, and it allowed us to open our to think broader. And I'm grateful to sir for telling us short ways to. And he also said us about the kidney walk app, from where we can just get the creatinine level easily rather than calculating manually, and also about the how we can get the dosing, prescribing drug profile, all the monograph about the drug. He also gave us shortcut about it. I'm thankful to everyone. Thank you, Jose sir.
So today's session in the morning was extremely informative, sir. I'm very thankful. I'm very thankful to you because this session was so informative. I would say so far the most informative sessions for me. The way you taught us stuff, I think I can retain it for a longer time than I'll normally retain other stuff. And one more important key takeaway from this was the teamwork we did. The team had students from first to fifth years. So that was one more important thing. Like we could discuss among ourselves, and we shared opinions with our seniors as well as juniors. So that was one more useful thing we did today.
Extraordinary, at least for me, because most of the time I don't interact much, and it's not more of a clinical side. We usually talk about technical stuff, yeah, medical writing and all that. So today was very nice. I came across so many cases, even though, in pharmacotherapeutics 1 last year, we did learn many cases. I guess we don't get to remember things we don't apply in real life as such. As today, Sir asked us the stomach pH for a drug, a cancer drug, you can say. Yeah, it gets only absorbed in acidic pH. And when he asked for the pH, me and my friend, we just blankly said 5.6, and he asked us, which planet are you living in? Because the pH of the stomach is something around 2 to 3. I guess it was intestine which we were referring to. So yeah, in yeah, in many ways we got to learn many new things. I guess, it's actually, the problem with me is it is retention of the memory. I'm very easy to grasp things. It's not the problem of learning. It's keeping it in mind. Even though, when we were referring for the need and stuff, we did learn this thing 100 times, but still today when asked, we just said out something blankly. And other than that, yeah, there were few cases which we were very keen about, like my case, which our group referred to as TB, meningitis. It was really a nice experience. We learned about, what can be wrong, what can go wrong with the case studies. For example, they can be subtherapeutic effects, they can be adverse reactions, overdosages, and, there are a number of possibilities. You have to look for it. Yeah, there were many things actually. If you want you to meet me for me to go to the clinical side, I can. Should I? Okay, thank you.